TV set right now. You're down to the program Health Matters. Una good evening. My name is Freda Okimama Izwagi. I'm going to be the person they bring on the program because on our health and on our body. And today we don't come again. We want to bring on our correct topic. What we want to talk about today. And what will be the topic? The topic where we say affect everybody generally. Where we say everybody, whether I'm a small pikin or whether I'm an old person, whether I'm a young person, everybody must definitely benefit from. And what will be the matter I want to talk about today? We want to talk about healthy living. We want to talk about healthy lifestyle. How we supposed to take care of ourselves. What would they healthy all through this year 2024? So now waiting one look at that because one thing when they talk they say health now be wealth. That means say if you don't get better health, your health not there okay. That means say there's nothing you can do about it. You know go fit make money. So that's why we know say this health is a very serious thing when they affect everybody. Where everybody they need to take conscious of so that make they fit live healthy and make they fit day productive. And we get somebody who will say follow me there today. Go follow me. Should to talk this matter. I know I know they talk alone. I know the person who will get for here today want follow me. Shook mat. And Dr. Matthew with me. I'm the CMD for Missions Clinic and Maternity. Where they here for Jet. So Doc, welcome to the show.
Thank you for having me.
Yeah. Welcome. So, like I talked about before, I say our doctor there will follow us talk everything generally about health. So we're going to look from exercises to your mental health to the food you're supposed to chop to even the water you're supposed to take. And now you fit generally stay healthy just all through the year 2024. Doctor, so I want to make quickly let our people know what will be the importance of healthy living, healthy lifestyle.
Well, thank you for that question. First and foremost, I want to really appreciate your intuition for picking that topic, at least for the first time in this year. Because today's 12th, right? We barely spent 2 weeks in this year.
Yeah.
And when you look around, you see people dying. You're right, somebody died. You look at your left, somebody died. Everywhere, I've heard of news of people dying now. Almost about 11 people or 12 people. Forget about the fact that I'm a doctor, I work in a hospital. This is not the death that occur in hospital. Deaths are occurring everywhere. You just said the news of people dying. So that's the need for this topic. This topic is also very, very important. It's a very important topic. Please, if you are at home, if you are alone, call your wife or call your husband or call your children. They should all sit down. It is a very important topic that we discuss now. Now, first and foremost, we want to discuss, it's important we know what health really is.
Okay.
The World Health Organization defines health as a state of physical, mental, psychological, and social well-being of the body. And not just mere absence of disease or infirmity.
Okay.
What it means is, even if you don't have malaria, you don't have typhoid or whatever, and there's something that's disturbing you emotionally, something is disturbing your mental health, you are not healthy. You are said to be in a state of good health when psychologically you are okay, physically you are okay, disease-wise you are okay, mentally you are okay, socially you are okay. So that is when they say you are in a state of good health.
So not be just only person be say they sick, what disease they but when the hospital be say the person no they healthy.
No, if somebody breaks your heart too, and you are sad, you have a boyfriend or you have a husband or whatever, and they break your heart and you are sad, yes. You are not in good health. Yes, it's all encompassing. It's not just you are not sick, you don't have a headache. No. When something is disturbing your mind, even if you don't have money, and you are sitting down, you are so lonely, you are thinking about how to make money and everything, you are not in a good state of health. You are not healthy.
Yeah.
So the definition of health is all encompassing. Both physical, mental, social, psychological, and everything.
Okay. So now what we talk about, like now, that's what we talk about healthy lifestyle. And I don't help us to understand, first of all, what it means to be healthy according to the WHO definition. So now, when we talk about healthy lifestyle, what is there encompass into it? What areas should they look? You don't about tell us one now, say mental issue, mental health, say even heartbreak self now, issue where you go look about. Definitely. So which other things definitely we need to check when we talk about mental, our health habits, what we're supposed to pay attention to?
Now, a lot of youths today, we don't pay more attention to our health. Now, when we are talking about paying attention to our health, it cuts across all fields. Now, is it there are people that usually they have what we call some kind of diseases in their body before. There are some people that don't have all kind of diseases in their body. For example, there are people that are battling with hypertension. There are people that are battling with diabetes. There are ways we take care of those ones. There are ways we cancel those ones. But for those who normally you don't have hypertension, you don't have diabetes, you don't have any underlying disease conditions. Now, the ways you can really take good care of your body, you will have to be in good health. First and foremost, we usually talk about smoking. That people should stay away from smoking. But there's one particular thing that people do not really understand about smoking. For example, if I'm smoking now and you are staying with me, you are at more risk of lung cancer than even me that I'm smoking. You staying with someone that is smoking, your health is at more danger compared to even the person smoking.
That is smoking, yeah.
Because that's smoking and smoking, the cigarette or whatever they smoke has a filter that helps to filter whatever goes inside of them. You that you are inhaling what is coming out of that smoke,
directly.
you are just taking it directly. So you are at more risk. You are at more risk. Your health is at more risk than the person actually smoking.
Okay.
Now we talk about exercise too.
Okay.
When you want to have a healthy lifestyle, exercise is also very, very important. Please, when you wake up in the morning, it's always good to do 1 or 2 exercises. I know it's very, very difficult. You know, most of the times when we talk about this healthy living, I tell people, I said, the people at more risk, they are the medically inclined people, the doctors and the nurses. They take care of people, but then they forget to take care of themselves. We take care of people, we forget to take care of ourselves. And then you see that this person died today, next tomorrow one else died or whatever. Yeah, we take care of people and then we forget ourselves. So this is also going out to all the medically inclined people. If you're in the medical profession, take care of yourself. Exercise is also very, very important. When you wake up in the morning, there's something we call brisk walking. You can just walk around your house. 10 to 15 minutes, you're going to brisk walking. 10 to 15 minutes per day is enough exercise to keep your heart healthy. Okay? Drinking enough water. Enough water. We'll see we will quantify it later when in the course of the discussion. Enough water. Keeping yourself hydrated. It can also help your mental health too. Because when you are dehydrated, it can make you to have mental problems. Okay? It also helps to lubricate your joint and prevent osteoporosis and all these joint problems. Alright? So, eating healthy food, like balanced diet, and abstain from all these junks. Alright? It's not as if you can't take yourself to all these eateries and eat 1 or 2 things if you desire to eat them. But everything you have to do, you do it in moderation. Okay, you do it in moderation. Alright? Eating, now there's one of my staff that, although it's not really staff, it's one of the people that train in the hospital. Every day, if you ask her, what do you eat today? Apple. What do you eat in the afternoon? Apple. What do you eat at night? Apple. Every day is only apple. So that is not a balanced diet, okay? I know that Nigeria is very hard for quite a lot of people. That's what they can actually afford. But at least there are vegetables, there are fruits, variety that you can eat, you can add to it. And then late night food. We advise people not to be eating late night foods. When you eat late at night, for example, 10 o'clock, 11 o'clock, you are still eating. And most of the time you eat you eat all this solid food. And immediately you eat, you go to bed to sleep. All these things accumulate in your body and they build up as fat in your body. And then you see that you start getting fat with time. So we advise people before 5, 6, you are done with your night food. At that time, you are not going to bed. You are still working around. You are still doing 1 or 2 things, expending and using the energy so that it's not stored in your body. So all these things are very, very important if you want to live a healthy lifestyle.
So at what age one supposed to be conscious about living healthy? Because some people will say, like now, I still dey young, make I live my life. So maybe by the time I reach that kind of 45, then of course I dey conscious. Say okay. So at what age should you start paying attention to our health? Because you know, a lot of people don't die anyhow. That means a lot of things is going on. So what particular age for those who dey watch us now say more could they conscious, more could pay attention to our health?
Now there's no particular age.
Okay.
Immediately a child is born. As a mother, as a father, as a parent, you must pay attention to that child's health. A child that is born today can die today. Anybody can die at any time. Carelessness on the part of the parent can lead to the death of any child. Okay, so there's no actual age.
Okay.
Although we say that men, when you get to the age of 40, be careful of your prostate glands. Alright? Go to the hospital, let them check your prostate for you. That is the age. When you get above that age, you start developing prostatic problems. We know of all those ones. But then, there's no particular age as to living a healthy lifestyle. Immediately a child is born. There was a child that was brought to my hospital now. She's just, is it 6 years old or 5 years old? we check the weight of this child is 28 kg. That's too much.
For a child.
Yeah. A child of around 5 years old or 6 years old. Yeah,
It's
by mere calculation, at 5 years old, you are not supposed to be more than 18 kg, between 18, around 18 kg. But this child is around 28, 30 kilograms. Wow. That weight is too much for that child. Yeah, that weight is too much for that. If care is not taken and the child continues like that, you're going to develop serious health problems later in life. So I counseled the mother. I was a grandmother. I counseled the grandmother. I told the grandmother this and this. Please pay more attention to this. And the child is very brilliant. Pay more attention to this child so that this child will not develop so diseases later in life.
That means we're supposed to watch what our children eat, because we feel that is a child. So a child take a lot of sugar. As a child, eat this. I want to pick it eat early for. What? They still have a lot of time there. So should we also control what they eat?
For infants, the most important thing they need is sleep. Infant, they just give birth to a child. The most important thing for a child, that sleep and that breast milk. Okay. Very, very important. You see, when they wean them out of breast milk and then they are giving them some kind of food, we teach them the kind of food they can give to them. Not just give them any kind of food you feel like you want to give them. No, that's where dietitian comes into play. For people that have the money to hire the service of a dietitian, it comes to play. You don't just give your child any kind of food, just eat this one, eat this one, eat this one. No, there's some particular age. For example, you give birth to your child today, we counsel you on exclusive breastfeeding for the first 6 months of life. Exclusive breastfeeding. The breast milk is 99% water. You don't need water. So there are some people that say, okay, when the child eats, the child needs to drink water. No, that's nothing like that. The breast milk contains 99% water. It has everything it takes for that child to grow for the first 6 months. And if you stay to that rule, that child can never fall sick within that first 6 months of life. But most of the people, they turn deaf ears. And most of the times I don't blame them. Is that all this mother-in-law, father-in-law, yes. And that's why sometimes when I want to discharge them, I used to call your mother-in-law. Come and sit down. Mama, don't give this child water. Don't give this child native medicine. Don't give this child this and that. Okay? There are most of the archaic things they do for children, especially infants. There's something at the front part of the head of a child when the child is born. We call it fontanelle. Very, very important. But they see it as something that is very bad. And this thing is important for the development of the growth of the brain of the child. And then they put native medicine, they put oil on that. They say, no, it's not good. So I tried as much as possible to counsel them. I tried to threaten them. So the address of your house is here. I will visit you. If I see anything on the head of this child, I'm going to arrest you. So we counsel them that after 6 months, then we tell them you can add this, you can add it. You still continue the breastfeeding for 2 years. It's important for the growth of the brain of the child. 2 years, minimum. Some people can extend it, but a lot of people will say, well, at 2 years, a child is already growing thick, it's going to bite my breast, it's going to bite this. There's absolutely nothing like that. And there's this misconception again that says, when it's getting to another 2 years, whatever the mess in that breast is just blood, it's not milk. There's nothing like that. It is still milk. Give your child the breast milk. It helps their brain to grow. A child that is breastfed for minimum of 2 years or even above, they do better in class more than those ones that are breastfed less than 2 years. Okay. This has been scientifically proven.
Okay. So now, after they grow older, should we pay attention to what they eat? Because we feed our children a lot of these fizzy drinks, snacks, biscuits, all those kind of things, and then we don't pay attention to what they eat.
It's important.
So say it's rice I want to eat, it's rice, and then you begin to feed them, and they're too small. I need for vegetables, no need for fruits. So should we pay attention to that when it comes to giving our kids?
See, even the Bible says, train your child the way your child will go. So when your child develops, it will not the child will not depart from it. So whatever you train your child with, that's what they will buy. For example, like me, I'm a Yoruba. I don't eat. They say amala is Yoruba food. I don't eat it because I wasn't trained with it. If I eat it, if I see it, it smells to me. So whatever you train your child with, that's what your child will
continue.
Exactly.
With. Okay.
So it's important you take care of what your child eats.
Now.
Listen to this. What you are discussing now. Listen to it and ensure that you also communicate to those ones who are not around when they come.
Okay, my people, if you be saying just join us on top of the show, you're there to the program Health Matters. The program will talk about issues that concern your health and your body. And what's the topic called to talk about today? We talk about healthy living, healthy lifestyle, how you fit to live healthy for this year 2024. Make sickness no break you down, may nothing touch you. From what our doctor does, I talk about the meaning of health. He said not be until when you dey sick, me say you dey healthy. He say at times self when we say maybe break your heart or something they disturb you, he said that means say you know they healthy. So this health matter what they talk about, I wanted the healthy ultra this 2024, it did encompassive. If you say just a generous on top of the show, you never lost, you still learn a lot from the show, what they talk about. So that's a more quickly jump now to the issue of water, because you mentioned about the issue of water. Say water, they good for our health. So we don't come to see some of all these messages put in person and say health. They say water, they feel clean some kind of sickness more for your body. If you take water, it will make the sickness not happen to you. If you take water, it will clean something. May you take water at the beginning of the day. A lot of things about water. Is water really that important and really, really helpful?
As important as water is, I said something earlier. Everything we do, we should do it in moderation.
In moderation.
Okay? Water is a very essential element, essential food. Let me put it like that for the body. It is very, very good. It helps to detoxify the body indirectly. The kidney is what helps to detoxify. Whatever you eat, the kidney detoxifies.
Okay.
Anything that has to do with toxins or chemicals in your body, your kidney helps to remove it. Now, when you are highly dehydrated, meaning you are not drinking enough water, your kidney suffers, and then your kidney will not be able to detoxify, will not be able to carry out its functions. When you are well hydrated, you drink enough water, it helps your mental health too. It helps your brain to perform at the maximum rate you want to perform. When you drink enough water, it cushions your joints. It helps your joint to work very well. It prevents you from developing what we call early onset osteoarthritis. There are some people that develop all these joint pains and they say they have arthritis and everything. Yeah, when you drink enough water, it helps you to prevent that at an early age. Okay? When you are dehydrated, when you're not drinking enough water, you can also develop kidney stone.
Okay.
Kidney stone is one of the things you can develop, because when you are really dehydrated, stones will be formed in your kidney, and this is very, very painful. When you have kidney stone, it's very, very painful. And then God helps you, it decides it's very small. Because when you develop kidney stone and the size, the treatment depends on the size of the stone.
Okay.
So when the stone is large, my dear, it's surgery. If it's still small stones, they will tell you the treatment is still water. You have to go back to water. If it's just medium-sized stones, they will tell you, okay, there are drugs we can give to you to help break the stone down into some smaller pieces, and then they will still tell you to go back to that same water therapy. Drink enough water. It helps to prevent kidney stones. It helps to lubricate your joints. It helps your mental health. It helps to detoxify the body. It helps your kidney to perform at a maximum rate. It helps your blood to flow very well in your body.
Okay, so what amount of water are we supposed to drink a day? What's the quantity like, and what time is the best time to take water?
Now, the amount of water that one person or each person needs to take per day depends on your location. And it depends on your location, and it also depends on the time of the year you are. Okay. If it's dry season, we counsel people to take more water. Because it's dry season, at that time, you sweat, you urinate a lot, you are losing a lot of water. So we tell people to drink enough water. If it's all this Harmattan period when there's cold, the amount of we don't sweat so much when it is cold time. Okay, the water we drink is usually less. But averagely, they say as for men, drink about 2.6 liters of water, about 10 cups of water per day. For women, about 8 cups of water per day.
Okay.
And then the timing.
Yes.
It is very good to drink water early in the morning and in the afternoon. Not that so good to drink water at night, but may I tell you that you will not have a good sleep if you drink plenty of water at night. You'll be waking up to be urinating at night.
Okay.
Do you understand? Not that it's not good for your body, but you will not have a nice sleep. You'll be waking up at intervals to urinate, and almost every 2 hours or 3 hours you'll be waking up to urinate at night. When you drink plenty of water prior to the time you want to sleep, you will not have a nice sleep.
And people talk about the benefit of taking water first thing in the morning when you wake up from. Say, as soon as you wake up from bed, you take water first before you know that. Say it gets a way of cleansing. I don't know.
Yeah, it's good. No, not really medical proven.
Okay.
But it's good to take water early in the morning. But usually, it also depends on individuals. Because when I was younger, if I drink water in the morning, my tummy turns me, I want to vomit. Okay. But now, it doesn't happen to me again. If I wake up, I can drink water. So it depends on individuals. If you want to drink water early in the morning, yeah, it's fine. It's good to drink enough water early in the morning. Yeah, it keeps your day going. It keeps you alert. It keeps you healthy.
Okay, so I'm going to quickly look at some of these silent killers, because some diseases we don't find them as silent killer. They know they can't tell person say they come Make we just enter. Also, people don't go see symptoms, say a particular sickness they come their body before the thing will strike them. And at times some people will all die immediately. And just recently we hear of somebody where say the person just dropped down and died. So when I begin to look at this thing when they say after this person now, this silent killer they talk about too. So I want make it tell people the day house now where they watch it. Make it cause some of this silent killer say go make us they pay more attention to our medical help. Because one thing about Nigerians for here, until when the person break down before we they go hospital. So is it important for us to also go for medical checkup in the year where we say not be say anything do me, I know they sick, nothing they worry me, but make I just go for medical checkup and then give us some of these silent killers so that people will take note of some of these things.
No, very good question. People don't really, you are very right. People don't really take good care of their health. One, if they don't fall sick, they will not know that there's a place called hospital.
Yes.
And if they fall sick, the first point of contact is native medicine. If that one doesn't work, they will take medicine from their friends. If it doesn't work, they go to chemist. It is when something is not deteriorating, the condition is out of hand, that's when they remember that there's a place called hospital.
Yeah.
Now, just like you said, there are diseases that are silent killers. One of them is hypertension.
Hypertension.
See, hypertension is divided into two. There is one that will show you sign. There is one that will not show you sign. There's no specific sign and symptom for hypertension. However, there are some people that have hypertension, that is high blood pressure, that will be having headache, will be having constant headache. And then you will not be able to sleep well at night. These two things will be those things that will drive you to the hospital to complain that I'm not sleeping well at night and I'm always having constant headache. And then we check your BP, your blood pressure, we tell you, oh, your blood pressure is high. And they say, but I've never had, you say, yes, because you've not been checking before. And then we start treating. But the second part, there are some of them, they don't even have any sign or symptom at all. There's this woman that usually comes to the hospital. Her BP is always 280, 140. She does not have headache. She doesn't have anything. It does not affect her. Those people, the first sign they first of all see, usually stroke. They will just wake up, one hand, one leg paralyzed, their mouth shifted to one side, one part of their face paralyzed. That is the sign. That's why they call it silent killers. Okay? And some that are not that lucky, they will sleep and they don't wake up. They just develop heart attack straight. And then people just wonder, what happened? We saw this person yesterday. This person just spoke with me just a few minutes ago. What happened? He just slept and did not wake up. And some of the time they tie it down to village people. It's not village people. They don't go for checkup.
For checkup,
okay, exactly. The woman I'm talking about now, I saw about 3 months later. I saw the daughter, and I was asking the daughter, how's your mom? I've not been seeing her. He said that's her obituary.
Oh,
obituary?
She died.
What happened? She woke up and she developed stroke because of high blood pressure. Instead of them to come to the hospital, they took the woman to a native man place. After 3 days, the woman died.
So what's your advice to people now if they know they go for because now just because the symptoms not go show. So how often should we go for medical checkup? So if we go for medical checkup, which things we suppose just go say make I go hospital go check myself, even when I don't feel the symptoms?
Now it is not only about I will still come back to this your question. Not only hypertension, diabetes too, cancer too,
There are plenty.
For all these silent killers.
Okay.
Please, if you don't go for hospital for all this checkup, you will not know. And for those of you who have family history, you have somebody that have high blood pressure in your family, you have somebody that have diabetes in your family, you have somebody that have cancer in your family, please always go to hospital for checkup. Okay. And then when you go to hospital for checkups, even if you don't have any family history, first thing they will check in the hospital, they will check your blood pressure for you, they will check your sugar for you. More importantly, they will check your urine. Urine is just like the mirror to the body. They will check urinalysis. We call it urinalysis. They check your urine for you. There are a lot of parameters they will check in your urine that will help us to know if you have one disease or the other. From your urine, they can know if you have liver problem. From your urine, they can know if you have kidney problem. Okay. From your urine, they can know if you have diabetes. From your urine, there are a lot of things that can come out from just checking your urine alone. Alright? Now, apart from sugar, BP, urinalysis, they will also check your BMI, your body mass index. They will check your weight and your height. That's the formula we use to calculate it, your BMI. If your BMI is above 30, that means you are obese. And when you are obese, there are health complications that come with obesity. And so, when they tell you you are obese, and they will also tell you what to do to bring your BMI down so that you'll be normal.
Okay, that will not get so much time, but I want to touch on this mental issue. So now this Nigeria it's very difficult for us to just really maintain our mental health well. So I want to give it talk to our people, and that's the last thing we have here. How will fit maintain ourselves mentally more they okay? Because you tell us say if you know they okay mentally, that means say you know they're healthy. So how can we maintain our mental state in a country like Nigeria?
Now, there are quite a lot of things that are disturbing us in Nigeria. A lot of factors, a lot of problems in Nigeria. But one message I want to pass across to a lot of you, please, if anything is disturbing your mind, any boy, any man, any woman disturbing your mind, please and please stay away from it. Your mental health is very, very important. When you are not mentally stable, a lot of things can happen to you. One, if you are lonely, always avoid loneliness. Sedentary lifestyle, avoid it. It can lead to a lot of things. Apart from the fact that it can lead to depression, mental problems. Sedentary lifestyle too can also contribute to diabetes, hypertension, and the likes. So when you are lonely, when you find yourself that you are always lonely, is it because you don't have money? Money will come. Is it because of the economy? The economy will be good. Everything will still be better. Okay, so if anything at all is disturbing your mind, please and please put it away. Your mental health is number one. Anyone is disturbing your mind, whatever, is it money? Money is going to come. Please, whatever you are doing, just be prayerful to God. He said He will bless the work of your hands. Just be prayerful. Continue to do what you are doing. Everything will be well.
Okay, thank you for coming to the show today. And people who watch us, thank you for joining us on the show today. Hope you don't learn a lot from the program we'll talk about. Our health, maybe our weight. So our doctor don't tell us, say, all through this year, be conscious about it. Say, I must stay healthy and watch yourself, watch your head, and also make it they go for medical checkup. May God continue to protect us. And I thank you for joining me on the show. My name remains Fred Aokimame Izagi. Bye bye.